Outcomes. If you think we got to stop thinking about devices and move to outcomes, because that's where, whether it's medical home, accountable care, blah, blah, alphabet soup, it's going to go there. Second issue is there's already a built-in market that's paying for outcomes, which is anybody who's capitated. So, if you begin to look at the Kaisers, the Intermountain, the Geisingers, Partners, actually San Diego, in the case of Sharp, has close to 500,000 capitated lives. So I would just think through that. The one thing that nobody asked us to do is political advocacy. We referenced you referenced a meeting with Kevin McCarthy, and I will tell you the Republicans love the issue. They absolutely love the issue because they have to offer an alternative to healthcare regulation, which is going to be healthcare solutions. And I've spent a fair amount of time with Kevin and others, and they love the issue. Oh, okay, let me understand this. Innovation that a bureaucracy that is symbolized by the Democrats is holding up job-creating innovation that's going to lower healthcare costs. Yeah, it seems like a pretty natural set of circumstances, and I think we all need to do a better job, because Congressman Bill Bray, Congressman Hunter, and others in this specific area have a huge amount of interest in it, and obviously are interested in San Diego becoming kind of a global capital of healthcare innovation. Anyway, I'm going to bring up our panelists. Actually, you've met Richard and Tom. You guys are coming up, but we're going to add Robert Jarrin. Jarrin is the head of government affairs for Qualcomm. When I came to San Diego about a year ago, I learned that was the first person that he could go by one name, Jarrin. I actually didn't know that whether it was his first name or his last name, but he was just Jarrin. It's just like Cher, it's Pele, it's Jarrin. So and actually there are a few people as well respected in Washington as Robert Jarrin, and as Qualcomm takes over the leadership position at Continua this year, we all should rely on Robert's very narrow shoulders, but they'll have to grow a little bit. Now, second, we wanted to invite somebody who has seen the light, who used to work in the government in Health and Human Services. Rod Benson is a counsel at Buchanan Ingersoll and comes to us with 35-plus years of government experience. Now he's in Washington, but he is already beginning to feel the thaw out here in San Diego. Got a round of golf in yesterday, sees all the innovation in the room. He's going to go back and he's going to tell his former partners that please get out of the way. There's an industry that needs to be created. But Rod, if we could ask you to come up. And Tom and Richard, you guys are just going to try and hide or what? And Jess is going to be, in addition to turning on my microphone, she's going to, if there are questions, we're going to get them up. Of course, they will screen the questions, not unlike the FDA. But if there are inappropriate questions, you will not hear them. But I actually had a couple questions. Why don't we throw it to the group? We had a pretty lively discussion around the importance of innovation. And I kind of led this off as, what do you think Congress knows, and what role can Congress play in helping sensitize some of the regulatory environments? And why don't we start, Jarrin, why don't we start with you in an answer, and then Rod, as a former recipient of the love taps from Congress, how would you answer that? So,
sure. So I'd like to start off by saying thank you very much for TICConnect for putting this together and for inviting me to come and speak on behalf of Qualcomm and also the Continua Health Alliance. I represent the U.S. Policy Working Group. I'm the co-chair. I share that with Intel. A lot of noise right now in Congress is on repealing healthcare reform. Obviously, that's going to be tough to do, given the Senate and the President have signaled that they're not going to approve that. However, that doesn't mean that that anything won't happen to portions of healthcare reform. And when we speak about healthcare reform, folks usually think, or typically have thought of healthcare reform in the aspect of the insurance reform. But there were also many references, more than 20 I believe, to health information technology and advancing the nation's healthcare delivery system. And those are the ones that are important to this industry. Whether or not they will survive will yet to be seen. I think that what Don mentioned about how the incoming Congress has such an interest in information technology and creating jobs, I think that's going to bode very well. For example, one of the things that healthcare reform was able to establish was the Center for Medicare and Medicaid Innovation. It's funded at $10 billion, $1 billion per year for the next 10 years. That's a significant amount of money. Will that be cut? I find that difficult to be seen, but greater and more awful things may have happened, which is why we have to be so proactively involved. I will say this, the incoming Congress is composed of many professionals, 20 of which are doctors. I believe 18 of those doctors are Republicans, and they really are very much interested in the advancement of health information technology. So I think that Congress definitely has their sights set on health and healthcare delivery and the reform aspect, the insurance reform, but also the technological impact of innovation. And I'll part by saying Congress last year was very much involved, obviously because of healthcare reform, but also on the periphery. There were a number of legislative hearings that happened. West Wireless Health Institute was instrumental in getting one done on the House side in Veterans Affairs, I believe the Committee for Veterans Affairs. Through Continua, we were very much involved in getting one done on the Senate Committee on Aging to speak about remote patient monitoring. I would not be surprised if on the Senate side, the Senate Finance Committee, which has been very much involved, obviously health is under them, if they don't have a hearing on health information technology and what has worked and what has not worked. So I actually see a very interesting legislative session coming up.